We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to 4NP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
If you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
Welcome to episode 1. So you graduated. Now what? And by the way, what the heck is an NP?
We are your hosts, Alicia, Colleen, Christina, and Oneida. Thank you for joining us today.
For today's episode, we will have some basics for students and non-nurse practitioners.
We're all going to discuss what happens after or as you draw near to graduation.
So let's get into our show. What exactly is a nurse practitioner?
So what do NPs do exactly?
So nurse practitioners provide a range of primary, acute, and specialty healthcare services, including ordering and interpreting diagnostic tests, lab work, x-rays. They diagnose and treat acute and chronic conditions such as diabetes, high blood pressure, infections, injury. They prescribe medication and other treatments, manage patients' overall care. They counsel, educate patients on disease prevention and positive health and lifestyle choices, and they promote good health.
So what makes NPs different from other healthcare providers?
According to the American Association of Nurse Practitioners, that's the AANP that I keep talking about, what sets nurse practitioners apart from other healthcare providers is their unique emphasis on the health and well-being of the whole person, with a focus on health promotion, disease prevention, and health education and counseling. Nurse practitioners guide patients in making smarter health and lifestyle choices, which in turn can lower patients' out-of-pocket costs. I like this definition from the 2017 article in the Journal for Nurse Practitioners. The article was by Dr. Tess Judge Ellis and Dr. Tad Wilson. They said, NPs develop strong relationships with patients, families, or communities. We work with these individuals or groups, emphasizing health and well-being of the whole person to promote health, prevent disease, and guide smarter health choices. This process may include screening, exams, laboratory and procedures, and medical interventions, for example, medication, prescriptions, and procedures. For more information, check out our show's notes that can be found on 4npspodcast.com. So it's funny, I learned a lot about my own profession when I was doing the research for this.
And I think that it all depends also on the practitioner that you're working with. So this is my third practice that I'm with. And the first practice, I only saw, it was in oncology, hematology. So I only worked mostly in the infusion center, and I would see the oncology patients if they had any reactions to the medications, and then kind of like the overflow. So if somebody called in and said, I need to be seen, and the doctor's caseload was busy, they would have me see the patient. My second practice, I saw patients, I didn't have my own caseload, but I had patients that I saw, for the most part, it was supposed to work that the patient would come in. It was also hematology, oncology. The patient would see the provider, the medical doctor, and then ideally the next visit they would see me and kind of go back and forth. And this next venture that I'm on currently is in GI, and we're kind of figuring that out. So it's kind of like, it really depends on the practice that you're in.
Oneida, you want to talk about primary care?
Sure. It encompasses everything. So from, I am currently, since I'm a family nurse practitioner, I see pediatrics. So from 0 to 100, basically. I think I saw a 103-year-old. So maybe 103.
What's your secret?
Diet and exercise? No.
I love it.
So, we care for the whole, right? We prescribing, so narcotics, all types of disorders and conditions we're treating. I'm also, having to be responsible for labs and, diagnostic testing and following up on the information needed, whether, there requires follow-up or whether I need to do a referral. I'm responsible for referring patients. As far as following up with pre-authorization, we do have an authorization department that covers that, and we do have MAs and RNs and LPNs that work at our location and in our practice that also follow up with patients, phone calls. They kind of screen if a patient requires immediate attention, emergent care, versus waiting to come into our office. So that's part of their role.
So Alicia, you just finished school and graduated and took your board exams. You want to talk a little bit about that?
Yeah, so just coming, fresh out of it is definitely a lot of hard work, a lot of hours. I did do the ANA on their website. They had a self-paced module, and I did sign up for that. It was a couple, like $300+. But you get a discount if you become an ANA member, so you get $100 off. So I did become an ANA member, and then I got the $100 off, and I did the self-paced. So the self-paced program is definitely different. It had some audio portions of it. I mean, you're basically going through slides and it gave you the information that was, I passed. So I can give that as a testimony that it did help, give you the required material to pass the boards. As far as being engaging, it would get a little flat at times, and it was kind of hard to kind of stay focused on it. But I had such a tight timeline when I started studying that I gave myself about 2 months, 6 weeks to 2 months where I was really, really studying. So I just kind of, as I was going, I had index cards. I would basically go through the slides. I'd write them down on my index cards, and I would just keep going through it. It definitely had a lot of material to cover. And then at the same time, I was using one of the leak books that you guys had shared with me. So I would kind of go through a topic on the module. Then I would go to the leak book, and I would compare, the information from that. At the same time, I would go on YouTube, just if I had like a certain topic, I would Google that. I would go on YouTube. I would find more information on that. Another resource I used, which I found really, really, this was engaging, it's something called Picmonic. And they have really, really great videos that like they do it in a little quirky kind of way where you can just remember, where it just like whether you see like if you're an audio and visual learner, like you have, these like interesting, like formats that they use just to kind of help jog your memory, when you thought, whether it was antibiotics, whether it was, respiratory diseases. And so it was just really, that was really good. And then there was a couple other resources that you guys gave me, but I'll let you guys talk about those as well. Because, I just pulled from everything I could to just get it all in there, which sometimes I thought my mind was going to explode because I felt like, and then there was practice exams. And when I would do the practice exams, I was like getting 60s and 70s, like I was failing them. So I just was like, what? So that was discouraging. However, I know they tell you, if you get a certain percentage, you have a good chance of passing, but I
remember texting you and being like, if you're getting between whatever 60 and 70, you're fine. They say you're going to pass.
Yeah, well, on the ANA, I think it said you should be getting 90 and above on those practice exams, which I wasn't. So when I actually went to take my exam and actually push my date back. So you can go in, once you set a date, you can change the date. You have a certain amount of time that you can do that. I forgot what it is now. But that second date I put in there, I was like, you know what? I'm just going to go for it. I'm going to see what this is about and, get it done and get it over with. And, thank God I passed.
I have to be very organized as far as my study process, because if I am not organized, it just makes my brain kind of explode. So I was very, I used the leak book, and I can't remember. I think I took the Fitzgerald review course. So I had that book, and then I also had the leak book. And then after I took the Fitzgerald course, I sat down and I took every single chapter from the leak book, and I wrote them down, each one on an individual index card. And then I purchased huge Post-it notes, and I put it on my wall, and then I would go through each line of the leak book, and I got the big Post-it note and I put it on the wall, and then anything that I would read that I didn't know, I would put on the Post-it. And then my whole entire house was those huge Post-its. I had it in the hallway, in going down the staircase. I had it in my office. I had them in the basement downstairs. I had them in my bedroom. Everywhere I had these Post-its, and that was for a good I think I gave myself 3 months to study. So I had that in my face 24 hours a day. And then as it came closer to the testing time, I did Picmonic, which I loved because I'm a visual learner. I would just go on the treadmill and just listen to the Picmonics because it helped me because on the test I would just like close my eyes and try to picture like that crazy whatever.
Penicillin pencil, something, whatever.
Exactly. And then I did YouTube. I can't remember the sites that I did. And then I did every question I could on the Fitzgerald and the leak. And that's what I did. Oneida, what'd you do?
I was not organized. I am your opposite. That's why we're friends, right? I was not organized. That's probably why I was unsuccessful on my first attempt. I kind of was all over the place with what I should study. I was using a couple of books. I used the Leak. I used the Fitzgerald. I wasn't sure where to go. I did give myself 3 months. So after I was unsuccessful, I kind of just stepped back, took a break, and then COVID happened. So I really had a break. And I used that time to kind of focus my study approach with board vitals. And I also used the Leak book, which I felt was the better for me between the Leak and the Fitzgerald. I felt the Leak was a little bit better for me to study with. So I used that in the board vitals. And I just really thought board vitals was just a good resource. It had a lot of rationales. Not just, they all have rationales, but it just explained it in a way where it worked for me. And then I was able to successfully pass my boards.
I think, though, you had a couple things going against you, too, is that we were working on our research project.
Oh, that's right. Oh, my gosh, how quickly I forgot. So Christina and I were working at the same hospital, and we were also in school together for our master's, our NP, and we were able to work together as a team on our research project. And our hospital was really interested in what we were, the title of our research project.
Which we'll talk about on a later podcast.
Right. So we were traveling for that. We were going to different states. We were, engaged in the whole
thing.
Right. But it was, it had to do with a specialty that we were in.
Yeah. And then the other thing was you were the first to graduate. So you didn't have we had each other, you'd be like,
Oh, I appreciate you just pumping me up.
It's true. You didn't have
to pave
the way.
Like you took it and then you could give me advice and then I took it and then we could give Colleen advice and then
you did.
on it.
I took advice.
And then we gave Alicia advice. So I think that
played into it.
Yeah.
But either way, here we are, and we're just trying to pass on what we use to really get success, in passing our boards.
What'd you do, Colleen?
I talk to you guys a lot. I am more like Oneida in the sense of I function in a little bit of chaos most of the time. I am definitely not as organized as I would like to be. I'm also audiovisual learner. So I took a look at the Fitzgerald book at first because I know you spoke so highly of it. And I couldn't wrap my head around the systems of it. It just wasn't right for me. So I looked online and I found a couple of other courses, and I listed some of them actually in the show notes for today too. Some of the ones that we're not really going to talk about because we didn't necessarily use them, but there are other options out there. But I ended up I took the Leak course online, and one of the things that I got from that course was she said to sign up there are 2 exams that you can take for your board exams. And she said to sign up for both of them, that she felt it would take the pressure off. And I really do think that helped me. I did not pass, and other than the 4 people in this room and 2 other people in my life, I didn't tell anybody that I didn't pass. I kind of went and took the Aanp exam cold turkey. I really didn't do a whole lot of studying for it because I just wanted to see where I was at. I really didn't know where I was at. I was like, maybe I'm going to overstudy and I really am where I need to be, or maybe I really need to buckle down and study. So I obviously really needed to buckle down and study. For me, I was really lucky in the fact that I was unemployed at the time. So what I did is I got myself a puppy so that I would have to get up really early in the morning. And I got up every morning at 5 o'clock in the morning to take my puppy out. and I would bring my puppy into the kitchen, and I sat at my kitchen table for several hours every morning studying. And the total hours were about 8 to 10 hours a day. And I did that for solidly, I did that for 6 weeks. There was definitely 6 weeks where I studied 8 to 10 hours a day, every single day, me and my puppy. Wow. I did use some of the leak notes that I had. I used Oneida. That Board Vitals was like, to me, that was great. So Board Vitals has an app and a website. It syncs with each other. So if I'm answering questions on my phone, it shows up on my app. On my computer. And if I'm answering them on my computer, it shows up on my app. So I had it with me at all times because it was on my phone. So whenever I had downtime, I'm waiting to pick one of my kids up or doing something, I would just answer questions. Mm-hmm. I also used FNP Mastery that Christina recommended to me, and I also thought that was really great. And being I am an audiovisual learner, but I'm definitely probably more audio than anything. And I used the Physician's Assistant podcast from Brian Wallace. Yeah. Brian Wallace is a physician's assistant, and we can go into that in another episode as well. But physician's assistants also take a board exam. The PANCE and the PANRA are their 2 board exams. And he created a podcast where he goes over every body system in enough detail that you really have a good sense of what's the anatomy and physiology that's going on here, what are the possible diagnoses, and what are the treatments for those diagnoses. And I thought it was really great. I used it all the time. I listened to it probably 2 or 3 times over the course of that time. I also went to YouTube a lot. YouTube for nursing students, if you're a nursing student at any level, there's so many things on YouTube that you can find information on. I know when Alicia and I were in undergrad school, we had a crush on Andrew Wolf, who has his own, this man. Oh my gosh, he's a professor in like Syracuse or something. He's upstate New York, Syracuse. He's a nurse practitioner, and he teaches a physiology class at a university upstate New York, and he has his own YouTube site. And if you are slow to physiology as I am, I literally had to take the Magic School Bus books out of the library to remind myself of the basic workings of our organs. Andrew Wolf teaches an amazing physiology course, and I've definitely watched that 2 or 3 times in my life as well. I also used Level Up RN. I can't remember the name of the nurse that does that. She's awesome. She has... podcast or? That's YouTube. Yeah, did I say podcast? I meant YouTube. Oh, I used USMLE.
Oh, yeah, the medical.
Yeah, it's a medical one. It does like, not acronyms. What do you call them when it's like... Acronyms. It has like visual... It's all visual
kind of like
stuff.
mnemonic, maybe.
It's, yeah. What's the word? I can't think of the word. It's like drawings of the things that are going on. It's a visual. It's for visual learners, but I specifically use that for the PEDS vaccination schedule. Mm-hmm. Very easy to wrap my head around it with what they had there. I also used Osmosis and MedCram. Those are 2 big YouTube channels for medicine. And then I also went to the nursing world. The ANCC has a website. That's the other exam. There are 2 exams. The ANCC is the one I passed. And they offer a practice exam for free. And I did that a couple of times throughout the course of my studying. But it was great. And I did finally, when I buckled down to study and do it, I committed to it. And I did finally pass it. So that was good.
So there are 2 different board exams. There's the ANCC, which is the American Nurses Credentialing Center, and then there's the AANP, which is the American Association of Nurse Practitioners. The American Nurses Association is the governing body over the ANCC. The ANCC has been around longer and certifies more specialties than the AANP. The ANCC has a few more different specialties that they can certify you in as far as a nurse practitioner. There's the adult gerontological primary care nurse practitioner, the adult gerontological acute care nurse practitioner, the family nurse practitioner, the pediatric primary care nurse practitioner, and the psychiatric mental health nurse practitioner. The AANP will certify you in 3 different specialties: the adult gerontological primary care nurse practitioner, the emergency nurse practitioner, and the family nurse practitioner. Both organizations can certify you in the family nurse practitioner and the adult gerontology specialties. All of the other specialties, there's only one option, and that's the ANCC certification.
For me, like, I was like, well, yeah, there's two of them. Which one do I take? I mean, I was kind of hearing that the ANCC was a little bit more
Challenging.
Yeah.
I heard that too.
And even I asked some nurse practitioners that I worked with, and like a few of them had the AANP. And then actually there was one that had both. She was certified. She took both and she passed both, which, okay, that's a world of confusion because you've got to keep up. Yeah, right. But there was one nurse practitioner that thought that maybe like the ANCC was like a little bit more prestigious, like to have that one.
Yeah, because I had heard that some hospitals, they prefer the ANCC. So I was like, well, I don't want to be limited, so I'll just do the ANCC. And I also like the research aspect.
I didn't. But okay. The research aspect. Yeah. But I think because you guys were all like, ANCC. I was like, okay, I'm doing ANCC. Like, I was just kind of like, yeah. And plus, yeah, because I had asked a few people.
And so if you have the AANP, then you are, like for us, an FNP-C.
Yes.
And if you have the ANCC, then you are an FNP-BC.
Board certified.
But they're both board certified. There really, at the end of the day, isn't a difference. So if you're a patient looking for a nurse practitioner, you do want to see that they have some sort of a certification, but it doesn't matter which one they have. This is all a matter of, if you're the master's educated nurse practitioner, you have to decide which one you want to take, or you can do what I did and take both and hope you pass one of them. So
some people do argue that the ANCC certification carries a little bit more weight than the AANP. You might find that one or two employers, and which is not many, prefer that you have the ANCC certification. Again, it's not common. Some say the AANP is easier and more straightforward. But again, in May 2019, the ANCC, and I'll go a little bit more into it, but they changed their testing. So there's no objective evidence that either exam provides a, quote, better certification, and it just comes down to people's preferences. But just to break it down a little bit, the AANP exam has 150 questions that need to be completed within 3 hours. All of their tests have the same number of questions, regardless of the specialty. The ANCC can have up to 200 questions that you'll have to complete in 3 to 4 hours. You'll also have to answer a minimum of 150 questions.
So I just took the test. So just to interject, it was 175 questions. Out of those, only 150 are being graded. So 25 of the questions are just kind of thrown in there as like testers, just to kind of see how we do. Exactly. And I had 4 hours on the clock. The first 30 minutes, I don't know if it was the same for you guys because you guys took a little. The first 30 minutes was just like a tutorial, which actually you could choose to take or not to take. I chose to go through it. That wasn't part of your. It was an extra. It was an extra 30 minutes. So the actual 175 was the 3.5 hours.
One of somebody somewhere, I don't know if it was a YouTuber or if it was Leak, said that you can take that time, that 30 minutes, to go over your cheat sheet in your head. You know?
Well, that's what I did too. Actually, I took they gave me like a little a sheet there, and right before the test, I had in my head memorized like the vaccination. I had all the different like mnemonics and all those different things that I just started putting down, like whether it was lab values, because maybe you're going to get into it too, because on the ANCC, they don't give you any reference ranges for the lab values, but I think on the other one that they can, like if they asked you like a lab value or something, they would say this is the reference range
in the question,
something like that. So you had to have those memorized, like, so I took that time to just jot down every chart, every diagram, every little picture that I had kind of in my head to help me, because I knew once I started taking the test, my mind was just going to be kind of all over the place. So it was nice to have that as that little side.
I definitely used the time for the same thing. I regurgitated. Yeah. I kept rewriting. I made like a cheat sheet for myself as I was going along, and then I would rewrite it and redraw it and rewrite it. And then I took that 30 minutes to do that. I just regurgitated it.
And I took it very seriously, the 30 minutes, and I listened to every word because I didn't want to get anything incorrect. And that's me, because I'm stupid.
Christina. No, I took it. No,
I was like, how do I pause it? What if I have to go to the bathroom?
Well, that's the other thing too, is that you're there, like in the testing center, like there's other people taking other tests. It wasn't just for the nurse break. And it's like the person or the proctor that was there, he's like, oh, your test, you get a 30-minute break. It's a timed break, and it'll tell you when to stop, and you can go to the bathroom, you can go to your locker, you can get a little snack. But then when he came to me, he said, oh, you're taking the nurse. Sorry, there's no scheduled breaks. However, you can get up and go, but you will still be time. The clock will still be going.
That's because they figure we're nurses.
There was no time for that. Yeah, there was no break for the nurse.
Nurses
right.
Don't pee.
And I just remember thinking, like when I was in there, I was like, oh, okay, at some point if I gotta go, I'll get up. But you know what? I just kept, I couldn't. The clock was like literally.
It's because we're all clenched when we're in there.
Yeah, and there was no time for that. Yeah. And it was fine though, but.
Fight or flight mode.
But that kind of stinks that we didn't get a break. But
I wouldn't have wanted to take a break.
I guess.
Once I get into it, if I'm focused in, I don't want to be distracted by anything.
Yeah. But then I was like, what if I get thirsty? Because you can't bring water in there. So I was like, what if I need something to drink?
No, but you could leave, and right?
You can step
You
out.
can, but the clock, yeah. And I couldn't afford time. I was down to that minute actually, but.
And something they don't tell you is you can ask for headphones or earplugs.
I have the headphones on.
Yep. Yeah. Somebody told me that, and that was great advice because I needed that.
Yeah.
I looked out and I took mine at home.
That's right.
Oh,
COVID.
okay.
Yeah.
What was that like?
I loved it.
How did that work?
They just, before when I entered the room, I had to make sure the door was closed. There was nobody else in the room. I had my camera on, and I showed them the room. I had to show underneath the desk, underneath my chair. They looked at everything around me. I was allowed to have a piece of paper and a pencil, and they just kept an eye on me after that. And I could have taken a break too, but I just...
Imagine that's your job. You got to watch somebody take an exam.
Yeah.
But I think they really watch your eyes if you're looking someplace or you're fidgeting or...
Also, do they make you turn your computer so that they can see everything? Because you could have everything in front of you
on your ceiling.
Yeah, I had to show everything in the room first, and then after I did that, then it was like, okay, you can sit now. And then I didn't move from that point on. I mean, I was like, talk about tense stuff,
Yeah.
I mean, but I just didn't. I just wanted to get done and through it.
That would be weird. I think I originally was signed up, and then they opened up a place, and I changed. I did what Alicia did. I changed my date for my the second time I took it.
Yeah, because you were the one that told me you were taking it at home. I'm like, oh my gosh, I have that option. And then I quickly signed up to take the exam again because I hadn't yet. I was just still like,
Yeah, remember I kept saying, I was like, come on, let's do it together. We could do this. Yeah. But no, I had a job interview that required some prep. So I just rescheduled it. And then I even had a moment where I was like, I don't know if I'm going to do this. But I did it. I was glad I did. Yeah. Although I'm still not working as a nurse practitioner. But anyway, that's an episode for another day.
I'm not either. Not yet.
All right. So for pretest questions, both types of exams have some questions that will be in there that are not graded. The Aanp exam has about 15 pretest questions, and the Ancc has about 25 pretest questions, and they use those questions to kind of gauge how they want to go about doing their next test and their next test questions going forward. So what kind of questions does the Ancc and the Aanp have? There's some differences between the questions on each exam. On the Ancc, you'll find questions about assessment, diagnosis, clinical management, and the professional role. But again, like I said, in May of 2019, they changed the test up a bit, and they rolled out a new blueprint for the family nurse. I'm speaking mostly about the family nurse practitioner exam because that's what I got, and I think what all of us got. But the blueprint implemented new content that reflects a move toward more clinical contact, and significantly less questioning on the professional role topics. And interestingly enough, the data shows that for the 2020 exam period, the passing grades for the AANP, I think, was like 85%, and for the ANCC, it was 89%. So that kind of flipped with the change in the blueprint.
Interesting. Right. You know what I don't like though is like I don't know what grade I got. Like I know I passed because that's all you.
That too.
I kind of was like, how did I? Like, how did I really do? Like,
did you know? No, you can write an S.
I think so. I thought I read that.
Like, I want to know my score.
I know that they gave this whole thing when you first sit down, you read something that says to you, it can take like an hour or half an hour before you could get your test results. So at the end of the exam, when it shuts down, I was sitting there with my headphones on, staring at the screen, and it popped up immediately and said you passed, and I gasped really loud, and I'm in a room with other people taking exams, and I went, and I was like, sorry.
So the biggest difference between the ANCC and the AANP are the exam questions. So the ANCC has more multiple choice questions, where you would select one option from many multiple answer questions where you select all of the options that apply. Hotspot questions where you mark a certain area of an image, and then the drag and drop. The ANCC exam also has a lot of images for you to work with, but they might show you things like EKG strips, pictures of physical symptoms, etc., for you to interpret and explain what you would do in that situation. So which exam is more expensive to take? The AANP exam is $315. If you're a member of the AANP, it's $240, and their membership dues have different tiers. For students, it's $50. For current practicing NPs, it's $150, but you can go on their website at aanp.org/membership to look at all of the different tiers. The ANCC exam is $395. Again, if you're a member, it's $295. And again, there's different membership dues, which vary by state and by tier. And their website is nursingworld.org. That information will also be in our show notes. So, knowing all of that information, which exam should you take? It really depends on how you study, what content you want. It just is based on personal choice. So you just have to go through all the information and figure out what you want to. How did you guys decide?
Alicia and I were talking about this a little bit before. Just like, it seems like that was the more prestigious exam, if you will. Maybe I'm not supposed to say that out loud, but that's what it seemed like. That was the one you wanted. It was going to be a little bit more challenging. I liked that it had research, because research is my thing. So I did like that part of it. But that was really, I looked at them both. I watched a couple YouTube videos comparing both of them. And I just really decided to do the ANCC originally. And then I only signed up for the AANP afterwards, after I took the LEAP course, when she said if it'll take some of the pressure off. And I did actually find that it took the pressure off, except that when I failed it, then I became like, okay, I have to pass this next one. But it motivated me and it wrangled me in, which is what I needed, because I definitely was a little bit all over the place when studying.
I think there was the same reasons. I just had thought, I'd seen the ANCC, that certification on more behind, the NP more than I did just that AANP one. So I figured I was a little apprehensive because it had research and it was not just clinically based. So I was a little apprehensive, but I felt like that was the way I should go.
Yeah, so I was still in school. Actually, you guys had already passed. And I think when it was time for me to do the research, I was looking into it, and it just seemed like just coming out of school was just like a lot of information. So I did consult with you guys, like what you guys had done and why. And it made sense for me too. And I did note that it was another, 25 questions in addition to the other tests, and that it had the other additional elements with, moral and ethical questions and leadership questions and clinical decision-making questions. But then I felt like, well, that makes sense because that's kind of what we do. So, I don't mind, that's good to kind of, get a good grasp and understanding of that. And so, yeah. And then I think I like the way it says BC after.
Yeah, I like the BC also.
I like the BC.
I never knew the difference.
Yeah.
I would see people with FNPC and then
Yeah.
FNPBC, and I was like, why does one put this and one? Why does one? Now I know.
We seriously could do a whole episode on the initials and credentials that follow a name, because I have my friends from college many years ago joke with me about that all the time. They're like, how many initials do you have after your name? What are all these initials? Now she's got more initials. Anyway, that would be a whole nother episode. Yeah, I did earn it, but I don't really go around. Even for my current work, I don't even usually put the FNP BC. I put MSN. I put RN MSN because I think that for what I do, those are the ones that people will recognize, and that makes me stand out a little bit. Yeah.
So we recommend that you look into each exam before making your choice, and the link for both exams will be in the show notes. So can you get certified in both the Ancc and the Aanp? Of course you can. Some may not recommend it, but it's definitely an option and obviously a personal preference. The only reason why you would need to take both exams is if you're considering a specialty that's not certified by just one of them. And then for recertification, the Ancc requires that you renew your certification every 5 years, and they require complete obligatory 75 CE or CME hours. 25 of them must be in pharmacotherapeutics, and complete one or more of the following categories, and they include academic credits in your certification specialty, presentations in your specialty, a publication or research in evidence-based practice or quality improvement, preceptor hours, a minimum of 120 hours, professional service as a volunteer, practice hours, minimum of 1,000 in your specialty, and assessment, or you could take the exam again. And that, again, is you would need to complete one or more of the following categories, not all of them. And the Aanp also requires that you recertify every 5 years. And for that, you have two options. You recertify by completing 1,000 clinical hours as a nurse practitioner and a minimum of 100 contact hours of advanced CEs or continuing education credits. And these hours can be as an employee, a volunteer, or as a faculty member. 25 of the 100 CE credits must be in advanced practice pharmacology, and you can also exchange up to 125 hours as a preceptor for a total of 25 credits. And of course, the second option would be to just take the test again. And I know people who would take the test again, and I'm like, are you crazy? I would never take that test again, but there's other options. Yeah.
That was traumatic. Like, no way.
I would not do that again.
Thank you for listening. If you like what you're hearing, please subscribe to us and give us 5 stars.
If you have any ideas or comments, please message us at 4npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4NPs Podcast. That's the number 4NPS Podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us.
Thank you for joining us, and we hope you'll listen to our next episode. What can I do with this degree, and how do I approach the job market? The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NPs podcast are of the hosts and guests and do not represent those of their employers.